Hello, in this video, I'm going to talk about a drug called Methotrexate. Now, the reason I'm talking about it, I was offered Methotrexate for treatment of my psoriasis, but I declined. And why I declined, that's the reason why I'm making this video. Now, what is Methotrexate? It is a drug which is prescribed quite often for treatment of psoriasis, also rheumatoid arthritis, or to treat certain types of cancer. If somebody has undergone a liver transplant, the use of Methotrexate is very common. Now, this works perfectly fine for many people, and that's brilliant. But the reason I felt that I need to do this video, because I felt that when the Methotrexate is prescribed, sometimes, at least in my case, the side reactions or possible side effects were not explained clearly. Now, if you are somebody who has been prescribed Methotrexate for treatment of psoriasis and rheumatoid arthritis, most probably you will be prescribed a low dose and gradually it will be built up. And it doesn't matter for what condition you have been given Methotrexate, the monitoring of the blood cells through regular blood tests when you are first given the medication, because sometimes your body may not accept the medication or it can have side effects, which I will come to in a minute. But so that monitoring is absolutely critical. Around the world, I know a case where because it was not monitored and patient wasn't educated, it led to loss of life. So let's talk about what Methotrexate you should know about the side effects. Now, if you are Methotrexate, it can affect the number of blood cells made by the bone marrow. Also, if you are taking any non-steroidal anti-inflammatory drugs like naproxen, aspirin, or anything like that, you must tell your doctor about it if they prescribe Methotrexate. Methotrexate also can cause damage to the lungs, lining of the mouth, and it increases chance of lymphedema, a type of cancer. So these are the kind of things you must know before taking Methotrexate. Also, Methotrexate can, in some cases, cause severe skin condition. If that happens, you need to go for urgent medical attention because they can be fatal. And Methotrexate can also cause fluid accumulation in stomach or around the lungs. So these are can be quite life-threatening conditions. In particular, Methotrexate can reduce your immune reaction, and that's where the blood test monitoring comes very handy, very must, because if the blood cells are going down, changing, and your immune system is no longer working, if you get a small infection, it can kill you. So all that I wanted to say is that Methotrexate is a good drug if it is used appropriately, but before taking Methotrexate, you must consider all the factors. For simple things like if you are taking alcohol, if you drink alcohol, you must tell your doctor, because then the dosage and whether Methotrexate is appropriate or not needs to be considered. So those little factors, I feel that sometimes doctors don't pay too much of attention. They prescribe the medication. And if you're the person who is taking it, you need to know, you need to understand. So for example, the increase in risk of cancer. These are the kind of things you must know and must make a decision based on proper information. Thanks for watching my video. I hope this makes sense. I wish you all the best.